Okay, thank you for joining us this morning for our webinar, New Draft Guidance for New Dietary Ingredients Notifications, featuring Todd Harrison. Todd is chair of the FDA practice at Venable, Nutrition Capital Network's law firm sponsor. We apologize for the scheduling changes for this webinar. It's been a very popular topic right now, as everyone knows, but we are all glad you're able to join us today. Following Todd's discussion, we will open up for questions using the chat function through the webinar link, or you can email me directly at mdovefish@nutritioncapital.com. So on to slide 2. The mission of Nutrition Capital Network is to facilitate the financing and partnering process for small and medium-sized companies in the broader health and wellness industries. We introduce investors and strategics to the next generation of successful brands and technology, facilitating capital flow and partnership opportunities. And we accomplish this mission by creating a series of events and virtual tools to connect companies and investors. On slide 3. Since 2007, 508 companies have presented at 25 meetings from our deal flow list of more than 2,400 applicants. Our investors include 260 entities that have attended NCN investor meetings, from strategic investors in CPG, food, pharma, and ingredients, to professional investors in private equity, venture capital, and family funds, to former industry owners, high net worth individuals, and angel investors. And our annual members, who we call cornerstone investors, have grown to over 40 in 2016. NCN has 9 sponsors and a screening committee of over 30, representing a range of industry expertise in brands, ingredient technologies, retail, and other subcategories of health and wellness. On slide 4, you'll see our focus, which is companies in the nutrition and health and wellness industry across the value chain that include everything from dietary supplements and ingredients to natural and organic foods and sports nutrition. On slide 5, you'll see our fall calendar, and we have 3 events coming up. Our first is our biannual education session and pitch slam event at Expo East, followed by our investor partnering meeting and venture tank at Supply Side West, and our fall investor meeting in San Francisco in November. So far, we have accepted 10 companies for our Supply Side West investor and partnering meeting, but have a few slots open if your company or a company you might know of would be interested in presenting. Slide 6. So I wanted to just list a few of our success stories from previous events that include Zico, Happy Baby, and Plum Organics. And on slide 7, you'll see specific ingredient technology success stories, Mycotechnology and Natreon. And you can find information on all of these success stories on our website if you want to learn more. Slide 8. Wanted to show our sponsors, and we want to thank everybody, all our sponsors that continue to support us in 2016. Venable has been our law firm sponsor for over 6 years, and we appreciate their support over the years. So with that, I want to introduce our speaker, Todd Harrison. Todd is a partner and chair of the FDA practice at Venable, and will be leading the call today, New Draft Guidance for the New Dietary Ingredients Notifications. So Todd.
Thank you, Mike. I appreciate the introduction, and we appreciate our partnership with NCN. As everybody knows, the FDA reissued their draft guidance document a few weeks ago, and it has caused a lot of angst among a lot of companies out there. They followed up that notification, that draft guidance document, with a proposal to basically ban vinpocetine based upon prior use as a prior IND and significant past clinical trials. So there's a lot of things that are happening right now. There are a lot of moving parts, but we're here today to try to go through this draft guidance document, what it says, what it doesn't say, and hopefully put some people at ease. Probably not many, because in the end, this is a draft guidance document. It's not significantly different from the one that was issued back in 2011. We actually had our associates pull that our comments in there, and they basically came back and said, you know something, we could just basically refile those same comments because it's all the same issues are still present in the new draft guidance document. So, just a little bit of a background. As we all know, the Dietary Supplement Health and Education Act is almost 22 years old this year on October 25th. And it defined a dietary ingredient as any dietary supplement that has a combination of vitamin, mineral, herb, or other botanical amino acids or dietary substance for use by man to supplement the diet or increase the total dietary intake, enzymes, tissues from organs or glands, or a concentrate metabolite constituent or extract thereof. Then we come down to what is a new dietary ingredient. That is a dietary ingredient that was not marketed prior to October 15th, 1994. And that's the demarcation date that everybody's really worried about. Because when you look at the draft guidance document, I would say that if you look at the field of ingredients that are available out there right now, probably 70 to 80%, maybe even higher, would probably fall into the definition of a new dietary ingredient if FDA were to enforce its policy as it's set forth in that guidance document. So if you're prior to 1994, you're considered a grandfathered or old dietary ingredient. If you're not, you either have to file a notification 75 days before marketing, or you can avoid the notification if the NDI has been present in the food supply as an article of food in a form in which the food has not been chemically altered. NDI notification must contain data demonstrating the ingredient safety, failure to comply with the NDI requirement renders the supplement adulterated. Something that's very important here, regardless of whether you are a new dietary ingredient subject to notification or not, you are still subject to the same adulteration standard, which is higher than the standard for old dietary ingredients. So regardless of when you're putting together your supplements or your ingredients, you really need to make sure you have a reasonable assurance of safety of that ingredient to avoid the product being adulterated. Now, FDA did promulgate some regulations back in 1997 regarding NDIs, but those were really formatting issues of how they wanted to be submitted, what information they would require, what want to see in that submission, etc. Then we have the Food Safety Modernization Act, which required FDA to publish a guidance document on NDI notification within 180 days of FSMA's enactment, which they did. They published their draft guidance document on NDIs in 2011. And they got, as everybody knows on this call, FDA got a lot of blowback on that, the initial draft guidance document. I guess technically they walked a little bit back from it, but when you read the new draft guidance document, it does look like they've walked back in any manner from it. Then August 15th, we got our new one. Like I said, it pretty much is a rehash of what was in the 2011 document. So you're a company that's looking to buy another company, or you're looking to add an ingredient to your profile. So you should always be doing your due diligence. So simply stated, it is taking the appropriate steps to ensure that the product being developed is safe, effective, properly manufactured, and distributed. The marketer of a product is ultimately responsible for safety, efficacy, and claims they make for this product. What amazes me oftentimes is how often in the formulation process, nobody pays attention to the safety of the ingredients or whether that ingredient could be a new dietary ingredient. Rather, they just, over the last 20 years, because of non-enforcement on FDA's part, companies have added ingredients to products that probably really are NDIs, but nobody's ever questioned that they're not. And so they've added. So we've had a situation now that we have all these ingredients in products that arguably should have been subject to NDIs because we didn't do our due diligence up front. But due diligence is just not safety. It's also the efficacy of the product. Do these NDIs have, why are you going to add a new dietary ingredient to the product if you have no evidence of efficacy? It makes little sense, and oftentimes a lot of the evidence these ingredient suppliers will have are 6-, 7-person studies which would never pass muster with the Federal Trade Commission or the plaintiff attorneys out there. So it's really important to dig down when you're looking to either buy a company or you're looking to add an ingredient to your own products to make sure that they have proper safety substantiation as well as proper efficacy. Now, NDI is only related to safety. A product is considered adulterated if the company fails to comply with NDI requirements. Now, what's important about this? If you have an NDI and you don't have, it was not found in the food supply prior to its marking as a dietary ingredient, if you don't file the notification, that ingredient and the supplement that contains it is adulterated as a matter of law. What does that mean? FDA doesn't even have to prove that the ingredient is unsafe. All they have to say is that you're a new dietary ingredient that was subject to notification and you didn't file that notification, therefore you're adulterated. So there are ingredients out there that raise that concern. One ingredient that may be of concern would be CBD. DMAA was one of those ingredients of concern. Now, we could talk about whether the constituents of a plant is enough, but FDA's clear position on that is it is not enough. So you have to start developing your legal arguments if you want to use ingredients that are novel. The consequences of an ingredient found not to be an NDI, not properly notified, or not to be a dietary ingredient in and of itself is that you have FDA enforcement, which is sporadic at best, private lawsuits, which is very significant because if FDA issues a letter saying that you're either a new dietary ingredient that was not notified or you're not eligible for as a dietary ingredient, these plaintiff attorneys are going to sue you over it. And they do watch FDA's warning letters. So some of the do's and don'ts for NDI due diligence: do analytical testing. Make sure that whoever you're getting your new dietary ingredient from has done the appropriate safety testing. Make sure that they have they've done just simple things like a 90-day rat study, or have an LD50. These are simple things that we should know about that ingredient and know about the mechanism, how it works. The basic way it works in the body should be known. Its mechanism of action should be known. Do you investigate the manufacturer ingredient site? Are they reputable? Always go visit their site. Never ever, I believe in trust but verify. Don't take the supplier's word for it that you don't have an NDI issue. Do your own independent analysis. Oftentimes I've come up with issues with some dietary ingredient companies that simply say, well, we're self-affirmed GRAS. Well, self-affirmed GRAS is a really nice thing, but if you're really self-affirmed GRAS, then you should file your NDI. Because if you have enough information to satisfy a GRAS position, you have enough information to satisfy NDI. So file your NDI. You have to ask your question. The question that companies should ask themselves, well, if you have a self-determined GRAS, then why not file the NDI? Because that means it's generally recognized as safe, that ingredient. So there's no reason not to follow the NDI. Get an expert consultant if necessary for scientific analysis and legal counsel to review that. Your lawyer should be used to make sure that the I's are dotted and the T's are crossed, and whether there are bases for avoiding the actual notification, because there are bases for avoiding the notification. So questions you're asking, is the substance considered to be a dietary ingredient? It's the first question you're going to ask yourself. Well, FDA relates that synthetic botanicals are not dietary ingredients. FDA continues to define amino acids very narrowly to only the alpha amino carboxylic acids used as a constituent of proteins or peptides, even though the language of the Act is not so limiting, nor is the legislative history as sparse as it is. I would also state there's no basis for FDA to conclude that synthetic botanicals cannot be dietary ingredients. We know on the grass side, in the food supply, we allow synthetics all the time, and they can have nutritive value. So the idea that we can't create a synthetic botanical, which would be more cost effective, and if we have a botanical that may be an endangered species or be about to become an endangered species list, why wouldn't we want to encourage a synthetic version of that botanical? Maybe we should have to do the notification, but that's no reason to just flatly say we're not going to permit that. Now, FDA did leave a little wiggle room in the draft guidance document on this issue when it went to ingredients that have been approved, has been notified to FDA as grass. But this blanket idea that synthetic botanicals should not be permitted is not good for the environment, and it's not good for innovation, and quite frankly, you can get rid of a lot of impurities that you may not want in a particular product by going down the synthetic route. And then probably the best reason of all is that the fact of the matter is everybody needs IP protection. And one way of getting IP protection is to come up with a synthetic version. So it should be understandable why companies would do that. As far as the amino acids, I don't really have a reply other than read the statute. The statute does not distinguish between alpha amino acids and other amino acids out there. So I think FDA just is going to have an issue if there was actually a case litigated over it. Is the substance a grandfather ingredient because it was marketed before October 15, 1994? If yes, then no pre-marketing notification required. This is a very interesting date because it means nothing. It just means that it was October 15, 1994. The ingredient must have been used as an ingredient and not for its technical effect on the product. Where we're going to really start getting the issues in this is, well, what is evidence of that? Well, FDA has said that, well, we want to see sales records, advertising, press releases, invoices. FDA will accept ingredients found in pre-DSHA food additive and GRAS regulations to support grandfather status. Affidavit inclusions in publications such as the 1992 Herb of Commerce are insufficient alone to support marketing status. So pointing to the Herbs of Commerce or any other method out there to show that it was on the market in the United States prior to 1994, other than those mentioned previously, are not going to be sufficient. But here's what is probably to me the most worrisome part of this whole thing. And that is that FDA, 22 years later, has now decided we're going to create an authoritative list of pre-DSHA ingredients. That's brand new. Now, I'm going to ask the question, and it's a rhetorical question because nobody's going to have a good answer, but last time I realized we weren't very computerized back in 1994. We had a lot of paper records back in 1994 and previous to that. And if a lot of companies follow the general rule of income tax that you keep your documents for 7 years, it's going to be really difficult to come up with this evidence of press releases, sales records, advertising. Would this have been a good thing to do back in 1994? Absolutely. That's when it made the most sense to do it, but FDA didn't do it. Now we're 22 years later, and this is going to be really, really difficult for the FDA and the industry to be able to verify accurately. And it should be really, really concerning to the industry because that positive list FDA will use against you and say there's no evidence that you were not on the market prior to 1994. To me, this raises the issue that maybe it's time, and I know people hate to hear this, but go back to Congress and say, given FDA's position, given 22 years of non-enforcement, it is time to reset the grandfather date and make it as of today or tomorrow, or whatever, and require FDA to formulate that list and that companies marketing the products provide that all list of all ingredients is marketing at this present time to FDA. I think that's the only way it's manageable at this point. And it's the only way that really makes sense, because otherwise you have a situation where you're going to have selective enforcement. And selective enforcement is good for some people and really bad for most other people. So it is a tool that the agency can use. It doesn't matter that they go after one company and not after you. They can do that. So again, to bring some sanity to this process is something that really should be considered by the industry to do. FDA also continues to state that changes in the manufacturing process may convert a grandfathered product to an NDI if the process alters the physiochemical structure or properties, purities, and impurities or biological properties such as viability or toxicity of the ingredient will result in an NDI. I can think of a lot of extracts out there right now that basically have altered at least they've altered the chemical composition in a way that increases the bioavailability of that particular ingredient. The question becomes is that are you now a new dietary ingredient? Or could you say that is it simply that I've added a fat to the carrier, and if I had not created the bonds between the two, it would have increased the bioavailability anyway. Unfortunately, that's not how a lot of those products are marketed. Using a different part of a plant could create an NDI. So if it is the root that was traditionally marketed as a dietary ingredient and not the leaf or the stalk of the plant, well, FDA's position is the stalk and the leaf, even though they have the same constituents as the root, are new NDI. So that's something that is very onerous and oftentimes very difficult, especially back in the old days prior to 1994, when quite frankly nobody paid attention to the part of the plant. You may just simply have an invoice that says ginseng. Is that ginseng root? Is it ginseng leaf? Is it ginseng stalk? Is it the whole plant? So those are things that you have to worry about. Solutions in water tincture may change the composition of a previously dietary ingredient enough to make it an NDI. Again, these are potential issues that the industry has not thought about. And quite frankly, it also goes against innovation. Things have happened over the last 20 years, and we shouldn't have simple changes like this create an issue. Now, of course, if you somehow nano-sized a particle, that would have significant impact and have significant systemic impact. So I could see FDA's position on taking something that is a microparticle down or a milliparticle down to a nanoparticle. That could definitely could change the safety profile of that ingredient. So I understand FDA's concern, but as far as I know, every time I've seen somebody say they have a nanoparticle, when you actually look at it, you don't actually have a nanoparticle. If the substance is an NDI, has it been present in the food supply and not chemically altered? If yes, then no pre-market notification is required. Again, this exemption is narrow. Present in the food supply means that the article is the ingredient, not the plant or the source that it came from. It is the ingredient. Must have been used in conventional food or a conventional food ingredient, not in a dietary supplement. But what's important about here is that if the article was used as food and was marketed as food, not that it was a constituent. So a case that many people probably have forgotten a long, long time ago called Colestin with Pharmanex, when FDA went after Pharmanex over their red yeast rice product. Now that has to do with whether lovastatin whether the red yeast rice with mevalonate was on the market prior to the institution of the IND and significant clinical trials. But there's a lot of really good information in that case. And what's really very important about it is that FDA recognized that even if red yeast rice is present, lovastatin or mevalonate, whatever you want to call it, is naturally occurring in plant materials at significantly low levels. I just call it fairy dust or pixie dust. If you manipulate the manufacturing process to significantly increase it, it makes it an ingredient in of itself, and you can no longer say that the red yeast rice was the ingredient. It was actually the ingredient is the lovastatin, because red yeast rice with a higher concentration of the mevalonate did not exist. So we see today oftentimes companies taking the position that, well, we've isolated an ingredient from a plant, but it was a constituent thereof, and therefore it's grandfathered because that's an old dietary ingredient. That is not FDA's position. And FDA has a reasonably good argument as a matter of law that they're correct. Now, there's a good argument on the other side that when you talk about constituents, because the Act specifically constituents thereof, that you should be able to rely on the constituents. What I would say to this is that if the constituent is there in the herb at minor levels, and all of a sudden, let's say you're taking it at 1 milligram and you're now marking it at 500 milligrams, you might have a really hard time convincing a court that that's not a new dietary ingredient, because that's not at the level it's present in the herb in the first place that was used as food, or in the food that we eat on a regular basis, whether it's an orange, a kumquat, a cherry, or whatever food we could think of that is out there. So these are things that you really should think about when you're trying to evaluate whether it's a new dietary ingredient or not, and whether you can rely on this exception. Not chemically altered means a process that involves an ingredient composed of one single raw material or derived from a single raw material using a manufacturing process that involves only physical steps and does not involve attempts to selectively increase the concentration of a particular active ingredient or cause a chemical reaction other than esterification that would modify the covalent bonds of any substance in the original material. Unfortunately, I'm not a chemist, but fortunately I have a PhD lawyer who works with me, so he generally explains these issues to me when I shake my head. But again, FDA is making it clear here that you look at the ingredient, not the whole food. Like the previous draft guidance, changing a fermentation medium from the one used to make vegetable foods in the food supply is a process that would likely chemically alter the food. Again, I think that's a huge stretch for the agency to take that position. I think that if they tried to enforce it, they would have a really difficult time in court with that particular position. Note that the adulteration standard of 20 U.S.C. 342 F1B still applies even if no NDI notification is necessary. Really, what you should look at the NDI, and there's a lot of misconception of what the notification is. The notification is not an approval process. FDA could go ahead and they could not do a draft guidance document. They could issue regulations, but they cannot make a notification process a approval process. It's not permitted. The provision in the Act says that the manufacturer must provide FDA with this reasonable basis to conclude that that new dietary ingredient is safe. It does not require FDA to look at it. FDA doesn't have to respond to it. And even if FDA responds to it saying we disagree with your position, the company can still go forward with marketing the product at the end of the 75 days. All it does is that it changes the burden. It shifts the burden of FDA to FDA to prove that the ingredient is not safe. Now, do you want a letter out there that FDA disagrees with your safety profile of the ingredient? Certainly you would not. But ultimately it's a burden-shifting statute. So once you file the new dietary ingredient notification, you are allowed to go forward with the marketing of the product, and it becomes FDA's burden to establish adulteration. Now, again, if there's not a lot of safety information out there and FDA can easily poke holes in your submission, that would tell you whether it is a smart thing or not to market that product. And again, I go back to the idea that companies want to use GRAS, self-determined GRAS. Well, if you want to use a self-determined GRAS position, you better make sure the FDA agrees with that. And otherwise, that self-determined GRAS position is not very helpful. So FDA in their notification requires a comprehensive safety profile, which is reasonable because for you to be able to make that decision whether there's a likelihood of safety here, you have to know what the safety profile of the ingredient, and it should be comprehensive. You should understand that ingredient inside and out. So I'm not saying it needs to be generally recognized as safe, but just from a product liability perspective, everybody in this call, I would quite frankly want a very good comprehensive safety profile of my ingredient. Otherwise, you put yourself at risk if somebody takes the supplement and has an adverse reaction of being sued in a product liability lawsuit because they'll blame the new dietary ingredient. So it's imperative that you understand the safety profile of the ingredient. The NDI comprehensive safety profile that you believe to be trade secret or non-confidential information should be identified as such. FDA is required to hold it secret. They're not supposed to divulge it. It does happen on occasion, but it's not done purposely. Accidents do happen. FDA will now accept NDI master file submissions. They must contain the manufacturing specification, other information describing the ingredient, can be incorporated by reference in NDI notifications. FDA did this to encourage the submission of NDIs when it's combined with other ingredients. So I believe it's the next slide, there's no need to submit an NDI notification for a new supplement if it just contains that NDI covered by the same company's prior submission. So all you have is that NDI in there, and since astaxanthin was notified, we'll just use astaxanthin as an example. If your ingredient contains astaxanthin and it's been notified FDA and you're using that company's astaxanthin that notify it, you would not have to do a new dietary ingredient notification. There's no need to submit a new dietary ingredient notification when a marketed supplement contains several pre-shaded dietary ingredients that have not previously been marketed together. Again, NDI is the ingredient, not the combination thereof. So if you have a bunch of old dietary ingredients and you market it in combination with each other, you don't have to submit an NDI. But I would strongly urge you to understand the safety profile of these ingredients that you're mixing and matching together. Again, just from a purely product liability perspective, that is something that companies should do when they're formulating products, and companies should make sure that they're doing when they're looking to purchase companies. But if a company combines an NDI with other ingredients, a new NDI notification is required. FDA's position basically is this. NDIs are personal to the submitter, except when it's a single ingredient. But if you're going to combine it with other ingredients, then you have to submit an NDI for your particular product. Now, be careful what you ask for agency, because if I were to take astaxanthin and I started notifying every single product that I know out there that has astaxanthin combined with it, the agency could be swamped really quickly with NDI notifications. Maybe another good reason to let's reset the grandfather date. I could think of probably close to 1,000 products right now that could be subject to notification that have astaxanthin in it. Could you imagine if the agency got 1,000 different safety assessments on an astaxanthin product? And let's say it's just with normal, vitamins and minerals in there. Do we really want to encourage that? Probably not, because the agency doesn't have the manpower to do anything about that. It cannot. It would bring the agency to its knees. And I'm not. If the agency's on the phone, I'm just being practical here. It's just not a practical, workable solution to what the agency is requiring. And on top of all, GRAS notification, if I do a GRAS notification and I say it's for X, if I'm going to market the ingredient in certain categories of products, that's all I need to do. I don't have to re-notify that GRAS ingredient every time I mix and match it with a different food ingredient. It would be an unwieldy process, and this is an unwieldy process. It's not a process that can work. The combination triggers the new notification even if the ingredients submitted alone were received by FDA and acknowledged without objection. The real issue, though, here is that, unfortunately, while I don't believe this is what Congress intended, it is how it's written. So FDA has reason to believe that's what a court would ultimately decide if they pushed in the show. In particular, FDA right now is interested in comments on manufacturing process that converted grandfather product into NDI, process that chemically alter an ingredient, how to compile independent and verifiable data to support FDA's authoritative list. I would also put comments into the agency about the last subject we just had. The idea that we're going to have to notify every single formulation, every time we change a formulation that it contains a new ingredient or different ingredients for NDI, it's just not manageable. There has to be a better way of doing it. Again, I think the best way to do it is somehow get the grandfather date reset. There are practical things that are not in the draft guidance document. There's practical things that the agency doesn't want to discuss. There's practical things that the industry doesn't want to discuss. But I'll go ahead and discuss it. FDA clearly does not have the manpower to go after every single new dietary ingredient out there. Not going to happen. It's not possible. It's just they don't have the ability to do so. So the number one thing is that ingredients that cause FDA concern are the ones that are going to be the ones that are most likely targeted. If FDA believes relatively that there's not a safety issue, FDA may, in its enforcement discretion, not move after that new dietary ingredient. But I kind of analogize this to, for those of you who are familiar with the DESI process for drugs and grandfather drugs, FDA allows the marketing of grandfather drugs if the labeling, et cetera, is absolutely the same as when it was prior to the approval process requirements in the C2 Act. Now, what happens in practicality is this. FDA does not take regulatory action against a lot of these old or grandfathered drugs unless a issue comes up for GMP issues come up in an inspection. Then they'll raise the issue of whether this is an appropriate marketed grandfathered drug. I think that's likely to happen here as well. The FDA will bring it up when concerns come up regarding the safety of the ingredient or that there's some GMP violation going on at the manufacturer and they notice one of the ingredients looks like a new dietary ingredient. That is probably the easiest point for FDA to raise these issues. Again, these are practical concerns that I'm raising here. And the practical is that if it's safe, you're probably not going to have a lot of issues with the agency. But is that a reason not to notify? If you have a lot of information on the safety of your ingredients, it doesn't hurt to notify it. You should be confident in your submission that you can submit to FDA and notify. If people are telling you that, well, I have a self-determined GRAS document, the answer is fine. You have a self-determined GRAS. File your notification, because if you have that comprehensive tox data done by a reputable tox group, then you're not going to have an issue with doing the notifications. So go ahead and notify it. And I would take it to a step further. Try to notify it as broadly as you can to incorporate ingredients that you may think, as your ingredient supplier, that you may believe would be incorporated in the supplement that contains that particular ingredient. So if it's an NDI that would be related to helping with joint comfort and mobility, well, you could try to notify it to include, in combination with glucosamine and chondroitin, things that we would normally see to help alleviate the need for other companies to constantly need to file a new notification. There's ways of doing this that would be helpful to FDA and as well as to the industry. But ultimately, it's your job when you're looking to add an ingredient to your portfolio to do your due diligence. Ask for the safety profile. Ask for the safety profile of it. If you believe that is an ingredient that was in the food supply, therefore it's still NDIN but not subject to notification, what is the basis for that conclusion? Where in the food supply was it used? How was it used in the food supply? These are all things I think are very important for everybody to do to ensure that things are getting notified. But unless we start taking companies that are marking NDINs as the ingredient supplier to task, it's not going to happen. And so we're going to constantly be in this state of limbo. And you're going to be constantly at a state of limbo, and that if FDA decides that you require notification, they're going to argue if they want to take action against you, and you're not going to remove the ingredient by yourself voluntarily, they're going to take you to court, and they're going to say your product is adulterated as a matter of law. They will, of course, argue in the alternative that regardless of whether it's adulterated as a matter of law, it's still not a safe ingredient. It's still adulterated. But they're banking on that they're going to be able to hopefully show the court that this is an ingredient that should have been notified. So I think that's it for my presentation. Does anybody have any questions right now?
Thanks, Todd. Yeah, we have several questions, so I'm going to start from the top. Okay, can everyone hear me? Todd, can you hear me?
Yeah, I can hear you.
Yeah, okay, good. Given their limited resources, is there a sense of what FDA priorities are going to be? Obviously, safety is a focus, but are there any other areas of concerns or hot buttons that you are sensing from the language FDA has been using?
I think what we could look at is those ingredients that we know that have INDs attached to them and or have been substantial clinical trials in the United States have been conducted on that ingredient, because that is an easy one for the agency. Because all they have to do is point to the IND and point to significant clinical trials and say you're barred from marking that ingredient as a dietary ingredient by the Act. Now, it's actually not that restrictive as FDA would like everybody to think, because let's take the vinpocetine. Let's just say for this conversation only, I'll take the agency's position. There's the IND and there's substantial clinical trial, therefore there is a bar. Let's not get into the synthetic issue, because I think FDA loses the synthetic issue. There's still a path within the Act that allows you to petition FDA or the Secretary of HHS, who will then shove it down to FDA to do it, to allow for the marking of that ingredient. So it's not a complete ban. There's actually a way of marking that ingredient still that allows you to get it on the market. So again, please understand, I'm not saying whether FDA is right or wrong in the vinpocetine. I'm just using it as an example. So we're just assuming, for the sake of this conversation, that FDA is right. Well, vinpocetine has never been approved as a drug in the United States. It's been used. We have 5 NDINs that were filed. FDA actually has an easy out here. They've looked at the safety of vinpocetine. They've looked at it and said, and came to the conclusion they didn't have any issues back when they were filed back then. So why not just say, okay, turn those NDI notifications into petitions and say that it's now approved for use as a dietary ingredient. FDA has that ability to do that right now. So that is something that we should really consider, that in some of these ingredients that are out there that, whether or not they were marketed prior to the clinical trials or not, if they've never been approved as a drug, why not do this? Look at it this other way and say petition the agency to permit its use. It's one way of doing it. But I think that's where FDA is going. So I think there are a couple of ingredients that are out there that could be at risk. And some of them are very well known. And I think that those are the ones that people should pay close attention to. One, figure out whether there's an IND filed for that ingredient before it was marketed in a dietary supplement. And 2, whether substantial clinical trials occurred prior to its marketing in a dietary supplement. So under the Act, there's 2 requirements. There's the IND requirement and as well as substantial clinical trials. Just the filing of the IND itself is not sufficient to bar an ingredient from being a dietary ingredient. Now we get into issues of the food ingredient and the food language, which is just substantial clinical trials, but general rule of statutory construction is the specific overrules the general. So those are questions you should be asking yourself at some of the ingredients you have, because that is the easiest attack point for FDA if they really want to go after some of these ingredients.
Okay, got it. Thank you. We have several questions, so I'm going to go keep going down the list. But if whoever asked that question or any of these questions, if you have some follow-up questions to your question, feel free to submit. And if we have a little bit of time at the end, we can go back and address them. Next question is about the grandfather status. Do the claims have to have existed pre-94, or can an old ingredient be used for new claims?
Yes, I mean claims have nothing to do with the ingredient. So you can develop new claims based on old and dietary ingredients that weren't used prior to 1994. It is whether the ingredient was what we would consider a dietary supplement prior to 1994. Understanding we didn't have that category in the United States prior to 1994. And so, yeah, as long as once it's marketed, if you can develop new claims for it, then that's fine. The real sticky wicket with it is, let's say you come up with a different standardization level. Let's say you go from a 10% extract to a 95% extract. Does that become a new dietary ingredient because it's now so purified to be that one constituent that you should notify the FDA of it? That's really kind of the $1,000,000 question, and I don't think if you read the draft guidance narrowly, then yeah, if you significantly increase the constituent, you're basically purifying the ingredient. Then I think FDA may take the position that's a new dietary ingredient because that's not what was marketed prior to October 15th, 1994.
Okay.
The one way, but there's a practical aspect to that too, Mike, and it's this.
Yep.
Let's just say you can get there from instead of taking 3 pills a day, you're taking 1 pill a day. Well, it's kind of silly to penalize people for coming up with an extraction process and saying that's a new dietary ingredient when the difference is taking a ingredient from three pills a day to 1 pill a day. It makes no sense to do that. But if you read this narrowly enough or broadly enough, however you want to look at it, FDA may be signaling that. It's something that FDA should clarify.
Right. Okay.
And people should clarify in their comments as to why those should not be included.
Okay. Good. Next one, there's two parts to this. What's the advantage for submitting an NDA once you have the self-affirmed GRAS in place? And in addition, is there any benefit to submitting the NDA instead of an FDA GRAS notification?
Well, self-determined GRAS means nothing unless FDA agrees with it. It doesn't mean it was used as in food. It doesn't mean anything. It means you're taking a position of self-determined GRAS. It's still a new dietary ingredient notification, still subject to notification, so there's no real advantage to a self-determined GRAS. I do like the question, though, the second part. If you really are self-determined GRAS, you're better off doing a GRAS notification because now you can use that ingredient in food and dietary supplements. It makes no sense not to do, if you really truly are GRAS, then do a GRAS notification. You know, self-determined GRAS, I get wishy-washy when people get there. This is the advice I give my clients all the time. Go ahead and do your self-determined GRAS, but do your self-determined GRAS to the specs that you would be able to file a GRAS notification tomorrow. Just because if FDA questions it and disagrees with you, that self-determined GRAS is of little value to you. And so I don't see, to me, I don't hold a lot of value when companies tell me that they have self-determined GRAS, but they're not willing to file the new dietary ingredient notification.
Okay. Next, do you recommend retroactive NDI submissions? If we feel that a supplement may fall, if we feel that a supplement may fall under the revised NDA definition according to this draft guidance. So a question about retroactive.
I mean, because there's no retroactivity. The guidance document is a policy statement. FDA it does not have the, understand, a guidance document has nothing more than a policy statement. It has no effect of law. The law requires you to file a new dietary ingredient notification. To me, if you have the safety data, file your notification. It is the best way to avoid potential issues down the road or anybody raising a question about the ingredient. If you have all the tox data that FDA sets out, then file the notification. There won't be an issue. The notifications that tend to get rejected are the ones that are really crummy. They don't get rejected. FDA just states they disagree with the position. They're really crummy submissions. But if you do a good submission, then you should have no concerns. And I think what you're going to find out too is that finished product companies are going to start pushing back, and they're going to have you file that notification anyway. So to the extent that you haven't filed it, I would urge you to file it. I have a different opinion on product ones. I don't. I think that the industry should show FDA what they're looking at by picking some really, tame dietary ingredients that have been notified and submit the heck out of it, and just show FDA this is a problem. We got to come up with a different solution.
Okay. Next question. What form should a response take? A standard letter format?
Response to what?
What form should a response take? Should it be a standard letter?
I'm not understanding response to what?
Well, I'll let that person, if that person wants to.
Yeah, I'm sorry, I don't know what we're responding to.
Yeah, that's okay. All right, let's move on to the next one. Any thoughts on removing the developments of an authoritative list, pre-Dichet ingredients from the NDI guidance to be addressed under a separate guidance?
This is going to be separate from. This is going to be separate. The list that FDA is going to be creating is going to be separate from the guidance document. It's going to be a totally different list. They raised it in here that it's going to be part, but it's going to be a separate list. So it doesn't matter whether it's separated out or not. I just think there's a lot of problems with trying to come up with an authoritative list because there's too many years gone by and a lot of that paper is gone. It will be a very difficult, I think it's going to be difficult on the agency. I think it's going to be difficult on the industry. And I think that, again, it's why I think we should just reset the grandfather date. But that requires an act of Congress.
Okay. And now someone has a question about form factor. So dietary supplements are to be taken orally. What happens if we have a product that is given topically? What kind of regulation apply?
Your drug. It's that simple. Okay. The definition of a dietary supplement is something that is ingested. So if you're not ingesting it, you cannot be topical. Now that becomes, if you're a topical product, you're either a cosmetic or you're a drug. Cosmetics cannot affect the structure or function of the body. It is for the beautification. So if you say, for instance, helps build collagen for a cosmetic product, that's an impermissible structure function claim for a cosmetic product. FDA has several warning letters out there. They send those warning letters out every once in a while, and nothing ever comes of them. And the cosmetic industry stops it for a while, and then the claims come back. But there is no natural product, cosmeceutical, that for topical products. It does not exist. It also includes vaping. You cannot vaporize something, inhale it, and call that a dietary supplement.
Okay, that's good to know. That's been on the increase, so that is good to know. We have 2 more minutes left for this call. We have 2 more questions, so see if we can get through them. What about the 1958 FDCA definition of food additive, which excludes GRAS ingredients from the food additive regulations?
It's not relevant. You can, yes, if an ingredient is GRAS and it is in the food supply, and it's used as an article of food, then a notification is not required. But just saying it's GRAS is not sufficient. It's still, if it's never been marketed as a dietary supplement, it's still a new dietary ingredient. So you still have a new dietary ingredient. Now we can get into the idea of if it was in the food, if it's used as food, article used as food, then a notification is not required. But if you're just simply saying, I went through the process and I have a GRAS document that says the ingredient is GRAS, that's irrelevant to the inquiry. You still have to notify. Because if it's never been used as food, as article of food, and it's never been in a dietary supplement prior to October 15th, 1994, you still have to notify FDA of its use. GRAS is not a relevant inquiry. I don't even know how we even got down this road that GRAS is a relevant inquiry. If you're GRAS, file your notification. They're 2 separate things. GRAS is a conventional food concept. NDINs are a dietary ingredient concept. They've never been the same concept. Now, if you're GRAS and your product's being used in food, and you really strongly believe you're in your GRAS position, and there's food products out there that have your ingredient in there, and somebody wants to use it, you can rely on that self-determined GRAS position. You're absolutely correct on that. But again, what happens if FDA disagrees with your self-determined GRAS position? It has to be lawfully marketed as a dietary ingredient. If it's not GRAS, it's not lawfully marketed. And just because you say it's GRAS doesn't necessarily mean a court's going to agree with you that it's GRAS. But it goes back to the same thing. If your ingredient is GRAS, then you have sufficient safety data to submit the notification. So submit the notification. I appreciate we've ignored this issue for 20 years. Not just FDA, but the industry has ignored this issue for 20 years. And they've taken this absurd position on GRAS. If you're GRAS, file your notification. If you were used in food then you don't have to do the notification. And by the way, used in foods anywhere in the world. So if you're used in food in Japan, or you're used for food in Europe, or you're used for food in Southeast Asia, you don't have to notify. You're still a new dietary ingredient, but not subject to notification. So I think that what people have to stop realizing is say, is this an ingredient that is used as an article of food? If the answer is yes, then the notification is not required. However, if you're going to say that, well, I took this ingredient, I did a self-affirmed GRAS, and therefore I don't have to file NDIN, no, that's not going to be sufficient. You file your NDIN. It's to your benefit.
Okay, thank you. Our last question, it's actually more of a statement, has to do with extraction processes. So here's a statement, and want to see if you have a comment to this. So solvent extraction and condensation are processes by which specific groups of compounds are concentrated. This is in conflict with the disallowance of purposely increasing the proportion of an active ingredient.
Correct.
Any thoughts?
Well, I think
on that?
That's the question I raised, is that if we create a new extract with a higher concentration of a constituent, have we created a new dietary ingredient? And I think the answer is to FDA probably is yes. But I think that you also have to look at it from a practical standpoint. If all I've done is take what is the normal use of 2 to 3 times a day to 1 time a day, well, do we really have a new dietary ingredient, or do we just have an old dietary ingredient and you need 1 pill versus 2 or 3 pills? Now, if you're taking it that you would take you 40 pills a day to get to that 1 pill, then I think your arguments get weaker.
So where do you think that, where do you draw the line there? Where's that? It's just one big gray area?
I think it's a gray area. I think it's going to be difficult to measure where that line is until FDA actually brings an action based upon a standardization level. My guess would be they wouldn't go for the ones that you're going from like a 10% extract to a 20% extract. I think they'd be looking at the ones that where you're going from like a 10% extract to like a 90% extract. But even then, if we're talking milligrams, that might not be a whole lot of difference in how much of that constituent you're getting on a daily basis. So I think that there's going to have to be a practical application to it. But I don't know the answer. I know one thing: if you totally isolate the molecule out of the ingredient, you are clearly not. You would be a new dietary ingredient in FDA's mind. If you just take it and you extract it out, you're going to be a new dietary ingredient. I think the closer as you get purification, when you start getting up to 90-95% extracts, well, there becomes a really good argument on the FDA side that your marketing is the constituent and not the herb that it came from.
Do you know why they specifically allowed for ethanol?
Because I think that's a normal process of extraction. I think that's the only reason why they did that.
Okay.
But I still think that even in the ethanol extraction process, if you take it from a low purity to a very high pure constituent, I think FDA is going to say you've changed the character of that, because it wasn't a 95% extract that was marketed prior to 1994. Those are really, I don't have a good answer for that, to be honest with you. I think it's just these are things that should be raised in comments, that FDA should, explain better. Because it's hard to rebut something that you don't really know, because there's inconsistent language in the draft guidance.
Yep. Okay, we're a little bit over. A lot of good questions. Todd, we appreciate you being on this call. It was very informative, and I have gotten a lot of good, excellent responses so far. And I don't know if you have anything left you want to say to wrap up.
The only thing I want to say is that everybody should file comments. Everybody should file comments on the Vimposity. I think that if there is truly concern over whether there is a bar there, everybody should really look at that one provision that allows FDA to approve dietary ingredients that even were subject to INDs and substantial clinical trials as a way of allowing some of the ingredients that never became drugs to be marketed as drugs. Especially if you can show it's based on the nutritive value of the ingredient. So I would really encourage companies to do that. I would encourage that if you have a self-determined GRAS, that means you went out and you hired a tox shop because you have an expert panel to have a self-determined GRAS. So they should be able to stand behind your self-determined GRAS. If you really have that, file your notification. Doesn't hurt so. If you want to put it in food, file your GRAS notification because that's even better.
Great. Okay, thank you, everybody. I believe you have both mine and Todd's contact information. Feel free to send us follow-up questions, and happy to help with any of your questions on this topic. So thanks again, and thank you, Todd, and have a good day.